Okay, good morning and happy Friday, and welcome to today's episode of the 2020 COVID-19 webinar series. Today's talk is called Understanding Mental Distress Among Children Receiving Home Care During COVID-19, and we are very grateful to have Dr. Luke Kalb, a personal friend of mine and a wonderful assistant professor at Johns Hopkins Bloomberg School of Public Health, joining us for the webinar. My name is Nassim Weisbord, and I work at LHC Group. And in addition to that, I am a board member and immediate past president of MNCA, the Maryland National Capital Home Care Association, who has worked so hard to bring these wonderful webinars to us. Today's webinar, as have all the webinars in this series, is brought to us by the Office of Preparedness and Response and a collaboration through the OPNR and MNCA, our Maryland National Capital Home Care Association. Their websites are both listed here for you. So if you want any more information, either about the Maryland Emergency Preparedness Network through the Office of Preparedness and Response, or for MNCA, which is the trade association in Maryland and DC for home health, private duty home care, and DME, please visit their websites or contact Dawn Seek, the executive director of MNCA, at dseek@mnca.org. Thank you very much to the Maryland Emergency Preparedness Network for making this possible. Some upcoming events. We had a packed November, and December started with a bang, and it continues to go strongly. And we've got some upcoming webinars starting on December 10th. We've got Dr. Linda Teodosio talking about post-COVID clinical considerations in the home from a doctor of physical therapy perspective. We've got Dr. Alan Abrams returning to us on December 15th, talking about caring for older adults that currently have COVID in the home. On December 17th, we have Ama Adepa Grin, a CNA with years of experience, who will give us her perspective from a CNA's perspective on caring for the caregiver. And then on December 21st, we have our very own Dr. Charlene Brown talking about aerosols, mitigating the COVID transmission risk inside clients' homes. So join us for all of those as soon as you can. Next, I'd like to introduce our featured speaker today. Dr. Luke Kalb is a public health researcher and epidemiologist who is not only a brilliant man and a wonderful man, but he's also a personal friend of mine. So it brings me even more joy to welcome him today. Dr. Luke's research aimed to improve mental health outcomes among vulnerable populations, especially youth, which translates well into today's webinar. And as an epidemiologist, he's been elbow deep in COVID-19 since as soon as this thing started. Dr. Kalb received his PhD from the Department of Mental Health at Johns Hopkins Bloomberg School of Public Health, and he's been recognized and published in numerous places. I won't read it all to you, but he's a good man and thorough. So with no further ado, I'd like to turn it over to Dr. Luke.
Thanks, Nassim. Appreciate the introduction. I'm going to go ahead and share my slides. All right, and then I'm going to. Can everyone see that okay?
Yes.
Great. I'm going to shut my door 1 second. Hold on. So speaking of children, I have a house full of children. We're all trying to do learning and talking. So if you see a rogue child come through, I think you all understand with the pandemic. So it's a pleasure to be here today. I'm going to talk about understanding mental distress among children receiving home care during COVID-19. So what's important to understand is, like Nasim said, I'm an epidemiologist. I'm not a clinician. And so that means that I study mental health in populations among broad groups. So what I'm going to present today is going to have a focus on that. What's also important to understand is, that there isn't as much research among children as there is adults. So I'm gonna discuss both populations, particularly because we know that parents' mental health deeply influences child mental health. So we're going to talk about what mental stress is. We're going to define it very specifically. Again, because I'm a researcher, I'm going to present a very research-focused talk. I'll try to translate it and make it as simple as possible. We're going to talk about the burden of mental distress among adults and children during the pandemic. We're going to talk about risk and protective factors among children and adults during the pandemic. And then we're going to spend probably most of the time talking about how to protect your family's mental health. And Nasim, if possible, if you could moderate the chat, it'll be a little tough for me to look at all the comments. If I need to answer any questions, I'm absolutely want people to chime in and ask questions. I think a good way is through the chat. So what is mental distress? So mental distress is a general psychological construct or concept, and it really describes a range of negative or poor mental health symptoms. We use this term because it's kind of very broad, and when we do general screenings and population-based research, especially in COVID-19, it gets to distress. It's not a diagnosis, but we're going to actually look at one of these screeners. But this gives us a pretty good indication if a person is experiencing mental distress in their life, which could be a product of many, many different things. So mental distress includes both mental states, mental symptoms, like depression and anxiety, but it also identifies behavioral patterns. So agitation, physical agitation can be, some screeners use problems with sleeping is a general kind of behavioral indicator, but we know sleep is often directly related to mental health. And so this construct is both relevant in children and adults. And we use these type of screeners both in children and adults. So we're going to actually look at a really common measure called a K10. And you're welcome to, I'll show you in a second, to think about where you might be at. It's frequently used. It's very common language. It's used in adults. There are a variety of different measures that are used in younger children. We'll talk about some of those symptoms, but there's a link here at the bottom where you can go on and you can look at all the different measures that are out there. So the K10 is called the Kessler 10, named after a guy named Ronald Kessler, who's a really famous epidemiologist at Harvard University. He designed this measure to understand from a population-based perspective. And so looking at these questions, you can see what they tap into. So questions about, have you felt tired for no good reason? Have you felt nervous? Are you so nervous that you couldn't calm down? Feeling hopelessness, restlessness or fidgetiness, depression or sadness? How often did you feel like everything was an effort, which again gets to depression? Did you feel so sad that you couldn't get up, or did you feel worthless? And so I broke down these items on depression versus anxiety, and then kind of general agitation. And so if you take this and you score this, or your child takes it and scores it, or you report about your child, these are the different cutoffs on this specific measure. It is recommended that in adolescents or children about 11 or older, you have the child fill this out, and then you have the parent fill this out as well, or a similar measure. And because they don't always align. And, you know, sometimes parents over-report and sometimes they under-report. It's recommended that you do this with a clinician. And so one of the first recommendations I give at the end of this talk is if you have concerns, I immediately contact your pediatrician or your family physician. So they're really, I think, the first stop because they know your child, they know the family, and they also are, many of them are trained to do brief screenings, and they can provide tools and interventions as well. But if they feel like your child is or your family needs more services, they're the direct line for referrals. And that's often a challenge for families is they just don't know where to go in times of need. And so your pediatrician or family provider can give that to you. So there's been, these are a number of different studies that I'm the first three that I've been a part of. And the last one is some colleagues of mine conducted as well. And I just wanted to give you a snapshot on what we know about adult mental distress. And just, I'm going to repeat these 2 points probably several times. Is one is we know much more about adults and their mental health during COVID-19 than we do about children. The reason why is doing pediatric research is way more difficult than it is in doing adults. To give you an example, all of these studies had adults who were participating in research and surveys before the pandemic, and they were able to follow them through the pandemic. We don't have as many of those studies in children. And also consent and ethics are more difficult among pediatric research. So, you know, when the pandemic hit, I'm part of a research group at Hopkins, and we were able to immediately launch these surveys in the field and get data back really, really quickly. And I'll give you some snapshots of this research. There's less of those ongoing type of studies in children. And so, you know, some of the highlights from the work we've done is in the early stage of the pandemic, we found that every day increase in the pandemic in March was associated with an 11% increased risk of psychological or mental distress with time. So as time increased, that was during the early stage in the pandemic. But that's pretty significant that as time ticked on in the beginning, and what's important to know is that as parents are feeling stressed, so are their children, right? So I think we can extrapolate some of this, and I'm going to share very specific child data, but if parents are feeling stressed, it's likely their children are as well. Again, early in the pandemic, among adults with no history of mental health problems, and so that's really key, we found that 15% of adults in the United States were experiencing significant mental distress. And this is much higher than you would expect. You would expect something probably around in the single digits, probably around 3 to 4%. But this is much higher, suggesting that the pandemic's not only affecting adults with a mental health condition, but those without. A more recent study in July of 2020, some of my colleagues found nationally that 13% of adults were experiencing severe mental distress. So if you remember when we went over that screener, that's all the way at the bottom. Typically, that's a small proportion of people in the United States. So in 2018, that was 4%. The numbers are now triple. So that's really concerning. And what's important, an important takeaway of this talk is in all of these studies, when there were any COVID-related factors, so we're talking about, yep.
I'm sorry, there's some feedback on the line sometimes. I don't know if it's like maybe papers moving or something. Does that make sense? That's
interesting.
I just wanted to make you aware of it. I don't know. Sorry.
Plug my headphones. Nothing's moving in here. Is there?
Oh, it might be the headphones. Yeah.
Is it the headphones? Okay. If
sorry.
Yeah, I don't know if everybody else is muted as well. Just I can't see, but just a thought. But is that better?
Yeah. Thank you.
All right, that's good. Yeah, thanks for letting me know. All right, so what do we know about children? So like I said earlier, far less is known. In fact, I couldn't even find a study in the United States. and the reason why, we talked about the difficulty with this research, but it also, there's a pipeline that research has to go through, right? You can think of data collection, analysis, and then just the publication process, it can be slow. That's important because the peer review process helps us kind of sort out what is good and what is bad information. And so what I present to you today is what I think is good information. And I give you those resources and links to follow up if you like. So what we do know is I highlighted what I think is the best study, and it came from China. They were they experienced the pandemic before us, so they had a little bit of lead time on data collection. And so they found that among 8,000 adolescents 12 to 18 years old in China, 43% met criteria for anxiety, 31% met criteria for depression, 37% met criteria for both, using online screeners like the one I just showed you. And that's double what we would expect in prevalence. When thinking about child mental health in general, about 1 in 5 children experience a mental disorder, psychiatric disorder in their lifetime ever. But that's in their entire childhood. To find these numbers for a one-time screening in a group this large is very, very high. So I think we can take away that mental distress, just like in adults, is very high in children as well. I want to share with you a very recent review that came out. And so it's a really nice look on what we know about in mental health of children during the lockdown generally. But there's also a series of recommendations in here for parents, teachers, providers. I'm going to focus on parents today. So in total, there's been 9 studies. Again, none of them in the US. They found that in very young children, what you tended to see was clinginess and feelings of fear. Both of these are precursors to mental distress. So it's important that when you see these type of behaviors, children present with mental distress, especially young children, slightly different. One of the things I talked about earlier is they may not be able to vocalize sadness and things like that. So what you see is this attachment to parents, or this generally concerns about fear. It could be fear of going outside, fear of partaking in activities that normally brought them enjoyment, but also the lack of interest in those things suggests depression. In older children, they found increased fear, isolation, irritability, sleep problems, poor appetite, and inattention were all increased in children. So this is a wider range of symptoms. In general, and I'll share this in a minute, that the older the child is, the more likely they are probably to experience mental distress. We find that with child mental health in general. So during the adolescent phase is really the critical phase for child mental health in terms of expression of those symptoms. What causes mental health in adolescence takes place all the way through childhood. Importantly, they found that decreased emotional expression was found as well, which is concerning because this could be due to a lack of stimulation, but being able to express your emotions is an important developmental characteristic. They found that the educational supports and socialization, so not having access to those, was a major risk factor for mental distress. Our lives have just been absolutely upended. And, particularly for children with disabilities is really important. So, education provides so much. It provides structure. It provides socialization and obviously education. But for kids with disabilities, they receive a lot of their therapies as well. I have one study. I didn't share it because it's not published, and like I said, I only tend to present things that are published that people can get access to. But we found that there's likely an increase in mental health symptoms among children with disabilities, and their parents as well. And so you can imagine, this is challenging enough for raising children, but being at home and not having the supports from family and community is just that much more challenging. And so it raises concern about regression. And so I think children in general, right, losing the skills that they had developed before COVID-19. So these are all major concerns. And there's recently a review looking back at all of these studies on social isolation and loneliness, which everybody's experiencing. And they found that, that symptoms that come after isolation and loneliness can last for up to 9 years. So the takeaway from that is, I think the effects of COVID-19 are going to be longstanding, even after we get a vaccine. The length of this pandemic and the burden of it. And if a child is traumatized or has a really adverse experience, maybe somebody got exposed, maybe somebody died in their household, the effects of this on children, I think, are going to be long-term. Before I get to the slide, actually, I just want to say one more thing. Like I said earlier, all of the COVID indicators. So if a parent was exposed, if a family member died, if parents lost their job, which is really important, if they lost income, if multiple people were positive in the household, all of those are related to increased mental distress. So when you think about caring for children in the home, if you find families that have been, differentially impacted by COVID-19, those families are at increased risk for mental distress, both the child and the parent. But just thinking, we can draw from what we know about child mental health generally. Everything we're pretty much finding out in adults is what we know about risk factors for mental health problems. And that's playing out generally in COVID-19. So, boys and males in general are at increased risk for behavior problems and alcohol and substance abuse. I think you're going to see data to show that boys have increased irritability, potentially, disruptive behavior, oppositionality. It's baked in a little bit with our genetics. And so that's, boys tend to express mental health symptoms early on in that manner, more often than girls do. But girls are more at risk for anxiety and depression. And so if you use the screeners that I presented earlier, you're going to pick up girls more often than boys. Older child age, I talked about in adolescence, increases the risk for distress. Males, and same for substance abuse as well. Behavior problems, on the other hand, tend to go down with child age, and that's because they have a greater what we call executive functioning. So behavior problems are often just the impulsivity side of child development. And so as children get older, they're not as impulsive, particularly with hitting and yelling and fighting. They can start to control those behaviors. And so, and disadvantaged background. So families that have a history of mental health problems, or families who have a history of disparities, particularly when it comes to income, so lower family income, potentially lower family education, those are families that are at risk for poorer outcomes as well. Not having, income lower levels of income was just a major risk factor throughout all our studies. So this, begs the question of what can we do about this? So, and that's what I want to spend rest of the time talking about. So, like I opened up, and I want to reiterate here, please contact a professional, a medical professional, and one that knows the child. They can provide you with immediate referrals, screenings, resources, and treatments. But what I hope this talk does is really open up a dialogue about well-being and mental health. Unfortunately, these two topics, particularly mental health, there's still a lot of stigma around that. There's a lot of families that don't feel comfortable talking about it, either their mental health or their child's mental health. This is impacted by a lot of things. Part of it just being recognition, part of it being stigma, part of it being cultural. And so, it's important that, we know that for us to receive treatment, we have to be able to recognize it. And so this is talking about everybody's mental health and well-being in the household. Children may not have the same language. What I showed earlier was probably more appropriate for older than younger children. So there are many different signs. But the one major sign is that all parents should be able to recognize is a change from the child's baseline or how they were doing during COVID-19. And that change is sustaining. It's something that just doesn't happen. We all have a bad day or two, but when those bad days turn into 2, into 3, into 4, into 5, into every day, that's when things get really concerning. When they're unable to do the things that they're typically able to do, that's another marker of concern. So things like agitation and irritability, things like being lethargic or just not having a lot of energy, in general sadness, loss of interest, decreased energy, but also eating patterns, whether it's overeating or undereating. Those are indicators of mental distress. And like we talked about earlier, clinginess or fear. So what are some things we can do about this? So maintaining consistent patterns. This is a challenge in our lives today. The structure that we typically had is just kind of totally broken. I mean, just things like getting on the bus, getting in your car, going to work. That's just not happening for most Americans and people throughout the world right now. So trying to bring that back into your day-to-day lives, we create schedules for everybody, and we find that helps keeps us on track. Even just getting up, getting in the shower, getting dressed. My wife likes to use the term "fake it till you make it." Sometimes that applies, especially in COVID. And sleep. Sleep is just, tons of research is coming out around sleep. It is just, we spend like a 30% of our lives asleep, and there's a reason for that. Not 30%, but it's at least 20%. So, or we should be, and that's because it's a restorative process for our bodies and our minds. And every study that looks at sleep finds that poor sleep in children and adults and older adults, it affects every outcome from attention to understanding information to mental health, to your ability to work on the job. It's keeping a good sleep hygiene routine is just really, really critical. That involves going to bed at the same time, minimizing technology before bed, minimizing technology in the room, and creating a space that your body's used to falling asleep in. So it's dark and it's quiet. Maintain physical activity. A lot of gyms are closed. Running outside, doing whatever you can to get strenuous activity, particularly for boys and children, is really, really important. Staying connected to others, another huge challenge. I've been able to do that partly through Zoom. I know that it doesn't have the same connection as being in person, but it affords a connection. And then outdoor activities. So whether it's walks or being outdoors with other people, I found have been really, really helpful. Nutrition, eating well, what goes in comes out. So keeping a healthy diet. There's evidence for getting out in nature as being an important wellness factor for children and adults. And I'm not sure if you can hear this, but there's an alarm going off in my community. And finding new activities, keeping the novelty going on in your life. Not easy to do, but important. So I wanted to highlight this in particular. So if you hear it, it's a test. That's the good news. It's nothing serious. So media consumption. So we did a study looking at social media and traditional media consumption. And so what you see is three graphs that look almost identical. And what is at the bottom is time, a date, and on the left-hand side is some type of measure. And so on the first measure, on the first graph, you'll see time spent on social media. And you can see that people are spending more and more time as the pandemic goes on. And then the next graph, you see time on traditional media. So that's like newspapers, TV. And as time goes on, you see that goes up as well. I feel like this alarm just got louder. And so what is at the bottom is mental distress scores. And so as time goes on, mental distress goes up. And so what we found is as one goes up, the other goes up. So what that suggests is using both social media and traditional media increases the risk for mental distress. And every study that I've started to look at around social media, particularly in adolescents, suggests that it's related to mental distress. But what's really interesting here is it's traditional media as well. And so, what we talked about in this study is the importance of being really mindful around media use and what we call doom scrolling. And so that's repeatedly looking, because the way websites are set up now, it has these infinite feeds, right? And you can just stay on that thing and look at whatever you want for as long as you want. And media sources frequently use sensationalized images to attract you to that content. And traditional media is using that more and more now as well. And so you really want to be mindful of what you're consuming and of course what your child and your adolescent is consuming. And if you have a TV up in the living room, everybody's consuming that. And so I just want to reinforce that being really mindful about media consumption is important. And so when you look for information on COVID-19, which of course is important, we recommend you use fact-based websites, things like the WHO, the World Health Organization, UNICEF, the Center for Disease Control, and really minimizing a child's exposure to these kind of graphic images. Another important take home is focusing on a child's good behavior. Positive reinforcement is being more and more recommended. It's been recommended forever, but the Academy of Pediatrics comes out and really reinforces that message recently. And just really trying to pay attention to what your child does right, rather than always paying attention to what your child does wrong. And because children often have behavior just for attention in the first place. And being a role model. I think that's really important. We learn by observing, and especially children do, right? Have you ever seen a child repeat a phrase that another child says, repeat a phrase that you say? That's because that's the way we learn as human beings. And so if you want your child's mental health to be strong, you need your mental health to be strong as well. And so I think that's a really important take-home message, and one for your clients as well. So if you want more information, this is part of a research group. You can go on that link down there at the bottom. Will take you to the work that we do, but we have a bunch of just articles. If you you can see there's a news and media tab. We've just written articles on just mental health in general during COVID-19 on just a variety of topics. You can go to our research studies, the ones that I showed today. And then there's resources and links for you as well. But included in that is I have a CDC website with daily coping resources for families that they can use. There's toolkits, information guides, lots of tools to assess your child, but also to communicate, not only about COVID-19, but also about their well-being and having that conversation. Children don't always have the words to express how they're feeling, and so these are really helpful information toolkits to start that conversation. And that's it. So I guess we can now move to questions.
Yeah, thank you so much, Luke. That was a great presentation and a lot of great information. I will, before we dive into any questions, I'm reminding people that you can put any questions into the Q&A button on the bottom of your screen, and we can go through them one at a time. Christina just asked if we would get the presentation emailed to us, and we will post the slides and the recording of the webinar on the EPN website, the Maryland Emergency Prep Network.org website. And we will send an email out also, just letting you know that the slides are up and can be viewed. Luke, thank you so much. That was a lot of great information. And I feel like, you know, being a parent to 3 kids myself, a lot of, you know, actionable items that I can start using, especially the focusing on the positive, you know, the positive reinforcement over the negative, and then also just being able to be a role model for mental health. Yeah, let me, Charlene, can you unmute Luke? And I was just, you know, noticing something about the social media and media part. I think, you know, we're all kind of aware of the 24-hour news cycle now, and how it's certainly with the election and politics in general, it's just gotten very, very aggressive and negative. I guess that's plays a role. Is there something about news media and social media that has gotten worse in terms of mental distress recently, or is this something that's been an ongoing issue?
It's been an ongoing issue. I mean, social media use, and, you know, unfortunately, adolescent mental health has kind of been deteriorating in the country for the last 10 to 15 years. I mean, in the country, you know, I don't know if I want to say the entire country mental health has gotten worse. Well, definitely during COVID. I mean, there's no question, right? I mean, what has not gotten worse during COVID?
Right.
But before that, I'd say we were maybe going down a little bit. But for adolescents, their mental health has definitely gotten worse. And so the big change the last 10 years was technology access, right? So many adolescents today have a cell phone with them, and particularly social media, and the amount of time spent on that platform. And the consensus is it's just not good. And so in the era of COVID, it could be particularly worse because a lot of our typical, behaviors and things we have in our life that keep us buoyed to good mental health has just been, the rug's been pulled from underneath of us. So I would say social media, yeah, we've known it's a problem. Is it worse now than it was before? I don't think we know that. But traditional media, which is really interesting, especially when I, talk to media sources about this issue, is that they were the same as social media among adults. So
interesting.
Yeah, it's not just social media. So, and I think we've seen that, and it's not that we shouldn't talk to COVID to our children. We should. It's just the way we communicate it is really important. And so the CDC has really good advice on that.
Gotcha. Thank you. Okay. We'll get into the Q&A. Our first question is, does interacting on Zoom and similar platforms help for children too?
So, all right, I'm going to do my best here. I'm not a clinician, but I know it's obviously a clinical topic. So, does Zoom help? It's not. I don't think it's as good as in-person interaction. However, I think it's better than nothing, and I think more importantly, it's about how the Zoom is structured, right? And so if it's chaotic and it's confusing, or there's lots of technical issues, or there's no agenda for that, for whatever is going on, it can be not particularly helpful. It's really influenced, I think, also by your child and their age and their communication style. So a 5-year-old is not going to probably do great on Zoom. A 16-year-old is going to find it easier to have a conversation on Zoom, just like an adult would, than a child would. So I think that, to give you an example in my household, we did this early in the pandemic. Unfortunately, I haven't been doing it as much, but we did group we did like a cooking show with my parents. And so
That's great.
yeah, we all like cook something together. Like we would organize, like we'd bake something. And so we all kind of threw it on. And honestly, I found like that to be great. And I still personally find Zoom to be more interactive than a phone call.
Right.
And so I think it's child specific, but I do think it's helpful. My daughter's on Girl Scouts on Zoom. I do think it's valuable that she's there and she's able to see other kids. Um, and it also depends on how remote you are and how closed off you are from other communities. I think that's an important factor. Some people, families are taking different approaches. And if your child's very, very isolated, I do think there's value.
Got it. Thank you.
Yeah.
Next question is from Christina, and she said her son is 5 years old and has been having a lot of behaviors that are not typical since COVID started. She's reached out to their pediatrician. Do you have any ideas or suggestions until they can get an appointment? Because it seems like they're looking at, at least a month-long wait until they can meet with a therapist.
Yes, I do actually. Can you just give me a second to pull up?
Sure.
Can you can see my screen, can't you?
Yes.
Okay. Let me stop sharing.
Sure.
And I'm going to go pull up a website that provides immediate assessment referrals.
That's great. Thank you. And for anyone else who was asking about slides, Charlene was kind enough to just put the link to the EPN website in the chat. And I'll show my beautiful face once again.
Okay. Can you see this MD BHIP link?
No, I think you've got to share your screen again.
So I put it in the chat box.
Oh yes, I see it there.
Yeah. Okay. So this is a 24/7 child mental health hotline and evaluation center and resource finder. So I think if you go onto that website, you should be able to find the phone number you can call and hopefully.
I think it might have gone just to the panelists. I'm going to repost that here.
Okay.
There we go.
It did. It just went to the panelists. It actually looks like they're 9 to 5, Monday through Friday. But yeah, I would start there.
Okay. Yeah. Excellent. Thank you.
Yeah.
Okay. Another question. And
okay.
This is
one other idea. Sorry, Nasim.
Sure.
You can call. So one issue is often with insurance, right? So finding a provider in your network, you can call your insurance and ask for a list of child mental health providers in your region, and they can give you a list of people that are in your network. And you can use that as a starting place to call around to find people and just call and ask for an appointment. So I think that's a good place to start as well is your insurance. So calling your provider, your insurance provider.
Okay, excellent. Yeah, that is something that occurred to me while you were talking about it. The fact that mental health, not only the fact that it still has a certain stigma attached to it, but that it's still struggling to gain recognition in terms of, basic insurance coverage a lot of the times. Like it's really playing catch up, even though it's such an important piece to wellness in general.
So when I found this out, I just was absolutely astonished. But, really sadly, it's been baked into our legislature. So I've been working, insurance providers do not have to provide the same amount of money or reimbursement to mental health providers as they do to medical providers. And
Right.
That had been written in the legislature for many years. And starting in the 1960s with the Kennedy administration, they began a series of what we call parity reforms. And that is that mental health coverage should have parity or equality to medical coverage. And that has only been finally realized until the end of the Obama administration. So it took 40 years to literally pay a psychologist the same as a physician. And so like it just shows you that that it's not only stigma like in our culture, but it's been baked into the United States laws and regulations. And I couldn't believe that. And there are caps too. Like you can only spend this much money on mental health, where you can spend
Right.
this much on medical. Like I couldn't imagine like who thought that was a good idea. But
Right. No,
fortunately, it's coming apart, but it's taken 50 years.
unreal. Well, yeah, at least it's heading in the right direction now.
Yeah.
Okay, so one more question currently in the queue, and this is a good one. Playing video games, especially now during COVID when we're all stuck inside, is that good or bad?
Yeah. So when it comes to video games, which is like what everybody was worried about before social media, right? It was
Right.
all about, our kids watching playing these video games, is it's causing aggression and all kinds of stuff. And so, my understanding, the consensus is there's a couple important factors. So one is your child's age, right? So a video game for 16-year-old is different for a 4-year-old. Two is the content they're observing. And so there are many, many, many appropriate video games, right? My kids play video games, but we're mindful of what they're seeing. So there are extremely graphic video games, and they're all marked when you go to get it. It's usually adult, teen, and then everyone, I think, is their ratings. And so
Right.
everyone is appropriate for everyone. Teen is appropriate for kids who are usually in that preteen teen era. But when you get into the adult stuff is really when you get into the stuff that is really kind of graphic, cursing, violence, blood, things like that in video games. And so the content, there is evidence to show that these violent video games can increase behavior problems in children. So long attention towards those type of video games are not good. A really good place to start is playing with your kids video games. Now that may be kind of bizarre to people that never play video games, but just sit with them, watch what they're looking at. You can play with them, right? We're forced indoors. It's unavoidable to spend more time on technology, and part of it's like, we're dealing with the pandemic. Like we may be kind of saving lives by doing that, but what we need to do is do it intentionally and try to make it as family oriented as possible. So if your kids are going to watch a movie, why not watch it together? Why not find something, if you can, that everybody wants to watch?
Right. So use the technology time as family time also.
Yeah. And if not, when everybody needs a break and do their own thing, is totally understandable. Just know what your kid's looking at. It is really important.
Gotcha. Okay, that's a great answer. Thank you. I don't see any questions currently in the queue. Maybe we can pull up that slide just to go over the websites one more time.
You want me to pull up my slide?
No, I can do, yeah, I'm just going to pull up on our end. So again, a very special thank you to Dr. Luke for doing this, and we'll post his slides in the coming days, and you'll get a notification about that. So his links will be in there. I just wanted to highlight one more time the Emergency Preparedness Network that made this all possible. And that's, again, through a grant from the Office of Preparedness and Response through Maryland National Capital Home Care Association. And you can see 2 email addresses there if you guys have any questions or need to find out anything else about them. Thank you. Yes, thank you all for being here. Cleopatra says thank you, and we sure do appreciate it. I'll give it, I think, just a little bit longer, just in case anyone has any last questions. But I think that was a lot of great information. It's, yeah, look, this is the first pandemic I've ever been through. I think certainly the first of this magnitude, and it's you know, there's no question it's been stressful all around, incredibly disruptive, and, you know, we're all trying to just kind of hang on and do our best. So thank you so much for all of your insight and help on that.
Yeah, the good news is I think things are looking up. I mean, it's gonna be a tough couple months, but there's a vaccine on the way, and so I think there's some hope in the future.
Here's hoping. Here's hoping. Yeah, it's just one more thing, you know, from what you had mentioned earlier, the fact that it has, you had said like a 9-year look back period, basically.
Yeah.
That you know, these, even hopefully we'll get back to normal very, very soon, and the vaccines will be smooth sailing and everything will go well. And, you know, I look forward to that day coming quickly, but there's no question that we have to keep this in the front of our minds, and especially look out for signs from our kids. And I think being that role model for mental health is also just more challenging than it sounds, but a worthwhile endeavor.
Yes, and you know, it will be, you know, kids that had a really hard time during the pandemic, they'll be they may be re-experiencing some of these symptoms in the future. I mean, can you imagine when the next flu season comes around, right?
Yeah.
Or any other hint of any other pandemic, right? It's these feelings are gonna reemerge for all of us. I mean, and we're all gonna be freaked out. And so I think we need to be really attuned to that, and attuned to our children who are more affected by this than others. This is, you know, mental health is a lifelong game. And so especially what happens in your childhood has long, deep effects on what happens to you in adulthood as well. So, so it's really important that we all invest in our children and our own mental health.
Right. Well said. Dr. Kalb, thank you so much for your expertise, and thanks for sharing your Friday with us. Absolutely. Everyone, thank you all for being a part of this and for tuning in. We hope to see you next time.
Bye.
Thanks, guys.